In 2017, Jewish philanthropists Mark and Erica Gerson created a major prize to honor the heroic work of Christian missionary doctors serving in Africa. Known as the L'Chaim Prize for Outstanding Christian Medical Missionary Service, the award gives the recipient $500,000 to help improve the continent's medical care. This year's winner is American Dr. Rick Sacra. Dr. Sacra has been working in the West African nation of Liberia since 1995. In 2004, this family physician from Massachusetts contracted the Ebola virus while treating patients at a Christian hospital in Liberia's capital city, Monrovia. Less than a year after beating the deadly disease, he was back in the African nation serving the poor and needy. Rick joins us via Skype from Monrovia, the capital city of Liberia. Thanks for coming on the show and congratulations on winning the L'Chaim Prize. First, what are some of the challenges you face in bringing quality health care to Liberia?
Well, thanks so much, George. The big challenges we face, number one is qualified staff, just finding enough doctors, enough nurses in this country. Some of the other challenges are just the cost of providing care. By the time you've paid your electric bills and bought your drugs, there isn't much left over to pay staff. And then finally, it's those critical patients who come who are so ill and you need someplace like an ICU or a critical care facility, and we don't have that right now in Liberia. And so it's very difficult to manage those types of patients.
What does the prize mean for your hospital?
So this prize is going to make a big difference over the next few years. Number one, it's going to support us training Liberia's first cohort of family physicians, fully residency trained family physicians. Secondly, it's going to help us establish an ICU and a critical care program at our hospital so that we can take care of those sickest patients. And finally, it's going to help us construct a solar electric installation that's going to help reduce our operating costs and help make care more affordable here.
Liberia was among 3 countries that suffered the most from the Ebola crisis back in 2014. What toll did the virus take on Liberia's healthcare system? Has it even recovered from that time?
In 2014 and 2015, about 400 healthcare workers came down with Ebola. 192 died. 5 of those were physicians. It did leave a big hole. A lot of those were our most experienced, most capable healthcare workers. But I will say, through the generosity of people coming and sharing their time and expertise and donations and contributions, I think that Liberia is now a little stronger than we were in terms of healthcare before Ebola. So the efforts of many different groups have made a big difference, and I think we've gone back now to even past the level we were at before Ebola.
You've served in Liberia for over 20 years, sir. What motivates you to do what you do every day?
Ever since I was a child, I was motivated by the words of Jesus in the parable of the Good Samaritan. Just his encouragement that we need to love our neighbors and take care of those who are hurting. And I've just carried that with me ever since I was a kid and learned that story in Sunday school. And, every day, just the relationships you have, both the wonderful relationships I get to have with my coworkers, Liberian healthcare workers, doctors and nurses, and then the relationships you get to develop with the patients are so rewarding. There's no job that's more rewarding than this one.
Describe what life is like for folks like yourself, medical missionaries who are serving in Africa.
Well, I'll tell you, it can be pretty draining emotionally. We lose a lot of patients. We find ourselves overwhelmed. We sometimes, we don't have the equipment to even make the diagnosis. A lot of times we're guessing as to what's wrong. So those are sort of the negatives. I think on the positive side is again those relationships, how close you become with both coworkers and with patients. I mean, I have patients I've cared for 15, 16, 17 years with terrible diseases, some of them HIV, other types of problems, but seeing them really experience the Lord's love in their lives and rise above those challenges is just, that's the bright spark that keeps us going.
You do more than meet the physical needs of the people, right?
Right. Well, when people come to the hospital, of course, they're afraid. They're afraid of dying. In this cultural context, people are often afraid of a curse or witchcraft being behind their symptoms, their illness. They're afraid of the pain that they're going through, and so we can help some of those things medically, but some of them we can't. And for those, we really are blessed that we're able to pray with our patients and bring them to the great physician. And we recognize that we're limited, but Jesus is not.
As I mentioned, the L'Haim Prize is presented by Jewish philanthropists Mark and Erica Gerson. You've met the Gersons on several occasions. What impact is their generosity having on the continent, specifically in the area of medicine?
By funding the work of missionary doctors who have invested a lifetime in the context they're in the African context, the Gersons are really putting these funds to maximum use. They're giving them the funds to people and organizations that have invested so much in figuring out what the needs are, what the most culturally appropriate interventions are, and these entities can make really cost-effective use of these funds. And so I know that these funds are making a big impact, and not just a $500,000 impact, but even it's multiplied because of the groups they're supporting and how they're being used. So I know in the other countries, they've had huge impact. And I know that in Liberia, too, over the next few years, there's going to be a great impact. People are going to recognize this impact, not just for the next few years, but as doctors are trained, that's going to impact Liberia for a generation.
And to know that this is a prize that is put forth by a Jewish couple, not a Christian couple, but yet they see the good work that you guys are doing right there on the African continent, and they are moved in many ways by your sacrifice, your sense of calling to minister in these very, very difficult conditions, countries, many times conflict zones. Speak to that and to their own faith and how that propels them to reach across the faith aisle to help folks like yourself to minister to the most needy on the African continent.
My wife and I did have the pleasure of joining the Gersons in their home and meeting them personally, and you could just really tell this was a conviction that came from the very depths of their hearts to do this. And they just recognized that how could they be obedient to their faith in God and in their Jewish faith. And they referenced many scriptures about loving those who were the stranger or the foreigner or the one far off, and how they saw that this was the best way for them to do that. And yeah, it was remarkable to meet them and to just see how they've really made such a practical impact out of those convictions coming from their hearts.
And you are the third recipient of the L'Haim Prize. Congratulations to you, and thanks for coming on the show.
Well, thank you so much. What a pleasure.